Hi, I'm Dr. Michelle Gerard, and this is Jennifer, and we're going to be talking about chiropractic and pregnancy today. So I'm going to take you through an actual adjustment, and we're going to include the Webster technique, and that's something a lot of you have heard about. So chiropractic is about making sure that the communication between the brain and the body is optimal. And there's never a more important time for that than when you're pregnant. And so we take care of a lot of women through their pregnancies, throughout the pregnancy, and through labor and delivery. They all tell us that it helps things go so much smoother, especially the women that compare a pregnancy with chiropractic and without. They really rave about the benefits of it. So first of all, we are working with the spine and the nervous system. And it's very safe to do this work, and our techniques are quite gentle. One of the things that we have to be concerned with is the pelvis, the shape of the pelvis. And the pelvic bones move quite a bit, more than one would realize. We have the pelvis here in the front, and then the sacrum in the back. And if these become subluxated or misaligned, the shape of the pelvis, this inner circle, becomes torqued or twisted. And that makes it difficult for the poor baby to transmit through that pelvic inlet. And so that's one of the ways that chiropractic helps. And so I'm going to go ahead and show you an adjustment so that you can see how that works. And you might wonder, first of all, how does a woman lie down on the table with the baby bump? And so Jennifer is 35 weeks at this point, so she has a significant baby bump here, and of course she couldn't lie face down. So we have this table that does all kinds of movements, and as she gets bigger throughout her pregnancy, we continue to lift that up. Is that high enough for you? Okay. And then we have this special baby cushion. So there's a place here, a depression, for the upper part of the baby, and then here's for the breast, so that as women are getting fuller and after the baby, when they're full with breastfeeding, they're comfortable here. Okay. So go ahead and lie face down. And then now I've made some changes in the configuration of this table. And is that good? There we go.
There we go.
And so now I need to raise the headpiece, but this table does it all. So, you comfortable there?
Yes.
Okay. So I'm going to go ahead and elevate her feet a bit. And the first thing I want to do is check her leg length. And so this is getting into the Webster protocol. And what I find here is that her left leg is short. And now when I bring, and you can see that it's short as we come up, and then it gets long again, and then as I press, I find that she goes easier on the right and is more restricted on the left. And that's an indicator of the sacrum being posterior on the left. And so I'm going to come around and adjust her sacrum. Now, in the beginning of the pregnancy, the sacrum is here. I'll use a drop technique on this table. But with Jennifer, as she's so far along in the process, I'm going to be able to use a gentle hand contact and sustained pressure and then a release. And I just felt that sacrum release. So this is the sacrum is moving quite easily because of the presence of the hormone relaxin. And relaxin is a double-edged sword. As the pregnancy progresses into that last trimester, relaxin levels are high, and that creates softening of the ligaments. So the ligaments are quite stretchy. And that's going to allow for the baby to labor through the birth canal and come out nice and easily. So the pelvis actually is allowed to spread. So I'm holding on that sacrum. I'm getting a little bit more of a release. Okay? And now I'm going to recheck. And she's level. So I'm going to go ahead and adjust in a more traditional way her upper thoracic spine. So I'm palpating upper thoracic here, supplies into the bronchial and lung area, and then I'm going to do a drop adjustment on her cervical spine. This is quite gentle, makes a bit of a bang as the headpiece releases, but it's very gentle. Okay? And now I'm going to have her go ahead and turn on her back. So we're going to get rid of this cushion and then lower this piece and have her on her back. And let her flatten out. And now I'm going to check for the round ligament. So the round ligament is a large ligament that comes off the sides of the uterus, and it comes down and attaches on the pubic symphysis. So the round ligament is designed to stretch. It's an unusual ligament in that it has muscular fibers as well. So it has a lot of spring in it to help hold the baby inside of the uterus. So the baby, think of the baby kind of in a sack. The uterus is holding that baby up. So often one of the round ligaments or both can become very inflamed and irritated, and I feel some tension on the left one. So my thumb is just basically pressing in on that ligament until it releases. And usually the mom will tell you, I feel the tension and she's feeling the tenderness. And it's often opposite the side of the sacrum that's involved. So we just hold it until I feel it release, and it has. And now it feels better. Sometimes we need to adjust the pubic symphysis, where the pelvis comes together here in the front, right below the bladder, and we don't need to with her today. But I am going to go ahead and check her to make sure that the muscles, the adductor muscles, are snug and tight, which is go ahead and hold. I really have a hard time separating her knees, and that tells me the pubic symphysis is in good alignment. So that's the Webster part of the protocol. And now I'm going to go ahead and check her cervical spine. And this is typical of how I adjust many people, pregnant, not pregnant, male, female. Very good. Okay, so that was a chiropractic adjustment and the Webster protocol. The stats on Webster are really quite remarkable. It was called the baby turning technique because it has over 80% success in turning breech babies. But it isn't me turning. It basically releasing the pressure on the pelvis and aligning the pelvis so that the baby and her body can do what it needs to do. But she's not breech. Her baby is head down, and it has been head down for weeks now. So she's in good shape, and we'll have a healthy baby within a month. So that's the Webster technique, and thanks for tuning in.